Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com, Causes of ganglion cyst on the wrist and how to treat it. A ganglion cyst is a fluid-filled capsule that can cause swelling on the hand or wrist. It is the most common cause of a lump on the hand. These cysts are benign, not cancer, and will not spread, although they may grow in size. /r/n/r/na wrist ganglion cyst is usually a cosmetic problem that doesn't require treatment and may go away on its own. If the cyst is pressing on a blood vessel or nerve, though, it may need to be surgically removed. These cysts also can be reduced by using a needle to remove fluid. /r/n/r/n This article explains the symptoms of a ganglion cyst and how it is diagnosed and treated. /r/n/r/n This photo contains content that some people may find graphic or disturbing. /r/n/r/n Ganglion cysts arise as pouches of fluid that come from the small joints of the wrist, or from the fluid within the sheath that surrounds the wrist tendons. /r/n/r/n When the fluid, called synovial fluid, leaks out from these spaces, it can form a sack-like structure called a ganglion cyst. The fluid within the ganglion cyst is identical to the normal fluid found within a joint or tendon sheath. It looks and feels like jelly. /r/n/r/n Minor trauma may be the reason for a leak to occur. Wrist arthroscopy can lead to a risk of ganglion cyst that's more than 8 times that of the general population, especially in females. /r/n/r/na Ganglion cyst on your wrist is benign, not cancerous, and it won't spread. It is important to have this type of lump checked by your healthcare provider to ensure it is simply a ganglion cyst. /r/n/r/n Ganglion cysts are usually noticed as a bump on the hand or wrist. Most people notice they may gradually change in size, and sometimes come and go, often depending on activity level. /r/n/r/n Ganglion cysts can occur on the back of the hand or on the palm side of the wrist. When they occur on the back of the hand, they are called dorsal ganglion cysts, and when they occur on the palm side of the wrist they are called volar ganglion cysts. /r/n/r/n Typical symptoms of a ganglion cyst include, /r/n/r/n Most of the symptoms are thought to be the result of pressure from the cyst on surrounding structures including tendons and nerves. /r/n/r/n Your healthcare provider will complete an examination and may order tests to diagnose a ganglion cyst. /r/n/r/n The appearance of the cyst is important to diagnosis. The cyst should not adhere to the skin, and the skin should have a normal color. One test to diagnose a ganglion cyst is to hold a light source, such as a small flashlight, against the cyst. Light will shine through a normal ganglion cyst because it is not a solid mass. /r/n/r/n Pain and tenderness are symptoms your healthcare provider will evaluate during a physical exam. /r/n/r/n Imaging studies can help your healthcare provider to rule out other causes of the lump, and ensure the structure and anatomy are normal. These tests can include Xrays, ultrasound, and magnetic resonance imaging, MRI. /r/n/r/n Watchful waiting and observation are a first-line option for treatment, since studies report that in up to 50% of cases, a wrist ganglion cyst will go away by itself. Sometimes, though, they may linger or even grow larger. There also may be groups of cysts. /r/n/r/n There are several methods of treatment for a wrist ganglion cyst. /r/n/r/n Many hand and wrist experts recommend no treatment for cysts at all. While some people don't like the look of a ganglion cyst, and some people have discomfort, the cysts are generally not harmful and many patients are reassured that the cyst is not going to cause any long-term problems. /r/n/r/n Treatment itself always has risks, such as tendon injury with a volar ganglion cyst. It's important that the benefits of treatment outweigh the risks, and waiting may be indicated. /r/n/r/n if the cyst can be tolerated, many experts advise they be left alone. However, the cysts typically form a type of one-way valve that allows fluid to enter but it cannot escape. As the ganglion cyst grows, it will put pressure on surrounding structures. This results in painful symptoms that are usually the reason for ganglion cyst removal. /r/n/r/n One traditional alternative is to hit the wrist ganglion cyst with a hard object such as a book. This pops the cyst and ruptures the lining of the sac. However, the approach is not recommended due to the potential for wrist fracture or other damage from the trauma of the treatment. /r/n/r/n A less risky pathway is the use of a wrist brace or splint to immobilize the wrist and protect it from further injury. /r/n/r/n Putting a needle into the ganglion cyst and aspirating the fluid may work. However, the jelly-like fluid within the cyst does not always come through a needle very well. Furthermore, this treatment leaves the cyst lining behind, and the ganglion cyst can return. /r/n/r/n 2023 review of 11 studies found recurrence rates higher than 50% in people treated with aspiration. However, the advantage of draining the cyst is that it is a simple procedure to perform, and the chance of a problem happening is very small. /r/n/r/n Surgery is an option for removing the wrist ganglion cyst, including the sac that surrounds the fluid. In addition, the connection to the joint or tendon sheath that supplied the fluid can be closed. /r/n/r/n While this is usually effective, a small percentage of removed wrist ganglion cysts will still return. Surgical treatment has been well described both as an open surgical excision and as an arthroscopic procedure. Talk to your surgeon about why one approach may be preferred. /r/n/r/n While most lumps and bumps of the hand and wrist are ganglion cysts, by far the most common, there are also myxoid cysts that typically affect the finger. Other conditions that have different treatments include /r/n/r/n As with other studies, a 2020 review of 34 cases found ganglion cysts to be the most common diagnosis when tissue samples were taken with imaging. But giant cell tumors, affecting 8 people, were the next common condition. /r/n/r/n Someone with a ganglion cyst may also be more likely to be affected on the same side with /r/n/r/n Your healthcare provider may need to treat a co-occurring condition as well. /r/n/r/n Ganglion cysts are very common causes of bumps around the hand and wrist. A ganglion cyst is not cancer and typically does not require treatment. If the cyst presses on nerves or blood vessels in the hand, causing pain, you may want to talk about treatment options with your healthcare provider. /r/n/r/n Options can include withdrawal of fluid from the cyst or surgical removal. In some cases, your provider may recommend a wrist brace or splint to reduce discomfort and keep the cyst from expanding. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.